Good evening. This time I will give presentation about clean water. As an island country, Indonesia is vulnerable to climate change. At present, the occurrences of extreme climate events have caused serious impact in many sectors, including clean water resource availability, and the limited resource of clean water in Indonesia also have an impact on sanitation. That is why Indonesia has taken into serious attention to that sector. Condition of water supply and sanitation in Indonesia. The number one, in 2011, only 20% of Indonesia population already had access to clean water. Water quality is poor regardless of socio-economic condition. A 2017 survey of drinking water found that 89% of water sources and 67% of household drinking water were contaminated by fecal bacteria. Moreover, only 7% of wastewater in Indonesia is treated. The number two, about 25 million people defecate openly every day. Nearly 25 million people in Indonesia don't use toilets. They defecate instead in fields, beaches, forests, ditches, streets, canal, or other open spaces. Open defecation is not only an affront to dignity, it also poses huge risks to child and community health. The challenge. Number one, poor access and management quality. The poorest Indonesians are being left behind, with significant gaps in access to sanitation among households in the two lowest wealth tiers of society, 40% in urban areas and 36% in rural areas. Number two, institutions that are not yet effective and efficient. Regional governments are still not equipped with policies and arrangements regarding the work procedure of the institution in charge of managing existing infrastructure and facilities. Furthermore, reliable and valid data on infrastructure and facilities for wastewater is very limited, making it difficult to identify the need for service improvement. The number three, limited development funding alternative. The lack of government concern about sanitation issues can be seen from the very small budget allocation for the construction of basic sanitation facilities. In fact, the dangers of environmental damage and declining quality of raw water due to a lack of attention to sanitation problems can lead to repair efforts that are 10 times more expensive than prevention costs. The number four, the low role of the public and private sector. The low level of education and knowledge of the community has resulted in many latrines that are not used properly due to people's lack of understanding. Unfortunately, there are very few non-government organizations engaged in the sanitation sector. Providing children with a clean environment to live, play, and learn. How do? The answer is building latrines and safely managed fecal waste together with hand washing is key to keeping children and families healthy. Safely managed sanitation is recognized as a top priority for improving health, nutrition, and productivity of people, and is an explicit target of the six Sustainable Development Goals. Reaching SDG, therefore, requires a closer look at strategies for reaching the poorest Indonesian children and families with better access to safely managed water supply, sanitation, and hygiene. So, the solution for this problem is the number one, from local government action. The government of Indonesia to accelerate access to safely managed water supply, sanitation, and hygiene. At national level, emphasis is placed on high-level advocacy and political will along with aligning water and sanitation policies and programs with ground realities and ensuring that they are based on reliable and up-to-date information and data. Number two, in community life, changing behaviors from building political will to creating a new national social norm in support of safely managed sanitation. Motivated social behavior change through high-level advocacy and engagement in the sanitation and water for all partnership, learning to support some national advocacy and through social mobilization in marginalized communities where open defecation is widespread. The number three, in a school environment help to improve the capacity of teachers in developing developing and implementing school sanitation plans, which involve promoting healthy practices such as hand washing and menstrual hygiene management. Thank you.